Hello and welcome to Sensei Podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei Podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure to introduce our guest today, who is Dr. Makoto Sekiguchi from the Fukaya Red-Cross Hospital in Saitama, Japan. Dr. Sekiguchi is one of the directors of the TOPIC meeting, the largest interventional meeting in Japan, and a world-renowned CTO operator. Again, Makoto, thank you so much for being with us today and looking forward to discussing with you.
Yes. Thank you very much, Dr. Manos. It's a very honor to joining you in the Sensei podcast. Sensei is the Japanese, means teacher. It is very comfortable sound.
It's a perfect. And thank you again. And maybe you can give us a little of your background.
Yeah.
How did you decide to become a CTO operator?
Yes. Nice questions. After I started the training of the cardiologist, I was interested in the echocardiography. And because the echocardiography is related with every heart disease. Yes, so heart failure, arrhythmia, and congenital heart disease. However, so echocardiography cannot cure the patient and the heart directly. And that time, so when I was training, so I was surprised at the effect of the primary PCI for the ST elevation, so myocardial infarction. And the patient with acute ST elevation myocardial infarction on the line between the death and the arrive. However, a primary PCI gets the patient on the arrive only 1 hour PCI. So I was surprised. So even now, so I believe that PCI is the most effective treatment in all of the clinical settings, all of the medicine. And so I decided to be an interventional cardiologist and started to run the basic cardiac catheter treatment. So several years I was trained basic catheter intervention, and the patient is CTO or compressed coronary lesion is explained from explains the difficulty of PCI or CABG from the other physicians or hospitals, and patients got depressed. And the success of PCI for those patients to make us and patients and me got happy. So especially CTO PCI requires experts for the techniques, and I decided to be an expert of CTO PCI. That maybe 2005. Yes.
And then how did you learn? I know that there is obviously a rich tradition in Japan. You have excellent operators. Many of the techniques started in Japan. How did you learn to do these complex procedures?
Yes. We know about 15 years ago, the retrograde approach technique was developed all over the world from Japan, and those days, I participated in the live demonstration in every weekend. And fortunately, so Dr. Osamu Kato visited the other hospital, but however near my hospital, so every month. So he showed so his skills and development of the retrograde uh, approach techniques. Mm. So I can run the CTO PCI with the retrograde approach mm, in the front of me every
Wonderful.
every month. Mm. And
Wonderful.
that time, the material is very material for the retrograde approach is very poor. Uh, hmm, there is no uh, my, microcassette with a longer version mm, and no Corsair and no Cyan Black. The guide wire and it's only so Miracle or Conquest. Mm. However, the
Wonderful.
Dr. Kato so always tries the retrograde approach and develops new techniques. Mm.
And then, how did you? I know it's a very you do some very complex cases with some very difficult epicardials. Um, do you get nervous when you do these very complex procedures? Do you get anxious?
Yes, mm, so yes, so I uh, mm, uh, yes, but however, so recently, so I'm not afraid and nervous, so because I understand most of the CTOPCI skills and their effects and limitations. Mm. To be stable, so we need to understand about the CTOPCI deeply and enough experience of cases.
Perfect. And then, how do you prepare when you do your procedures? How do you prepare for the CTO cases?
So now, I participate. Mm, the prepare. Yes.
Hmm.
So
Yeah.
after the patient decides to undergo a CT PCI, of course, I check the coronary angiograms and CT angiograms, um, and make a CTO notebook. For several days, I read the coronary angiograms for a short time, not so long, but every day. Mm. So
Okay.
especially CT morphology and the collateral channels. So I usually make a plan and note it on my CTO notebook.
Okay. And then, do you do coronary CT for every case or for most cases that you do?
So
The CT angiogram?
yes, yes. In the patients in my hospital, so mm, all of cases undergoes CT angiograms before CT or PCI. However, I have many chance to visit the other hospitals. So sometimes there is no CT angiograms.
Okay. Okay. Wonderful. And then, do you continue to learn? Do you feel you've becoming very good, or do you find things that you continue to learn even now after all these years?
Mhm. Of course, Mm, I read the textbook. This is one of my favorite books. This is your sign.
Well, now it's a long time we met,
Yes, a
so
long
it's
time.
a small world.
Yes, I participate in the Raymond. live demonstration and so many meetings. And fortunately, so there are so many CTO experts in Japan. So every weekend, so we discuss about the CTO PCIs, of course, about the new techniques, new devices. Um,
Wonderful.
uh,
And then, how do you get the new? I know there is a lot of innovation in equipment for CTO. How do you incorporate the new equipment and techniques in the things that you do in the cath lab in your practice?
Usually, so we should use so proctorship system. So by the
Hmm.
products company, and I sometimes learn from the so live demonstration or published article and meetings. So uh, of course, I especially so I make an effort to understand the efficacy and the risk of the new techniques and devices.
Wonderful. And then, what was the best case that you've ever done?
Mm, I have so many good cases. However, so my so unforgettable cases are worst cases.
Yeah. So, are there any of those cases, good ones or not so good, that you remember that taught you a lot?
Mm. Yes. Mm, my unforgettable case is the worst case. So, of course, so some cases very good cases, and many so maybe so over 10 years ago. So I studied the retrograde approach techniques and ran it. So the patient, 50s male, uh, mm, ad, admitted to our hospital with microinfarction. His coronary angiogram shows three vessels occlusion, and two CTOs, uh, one of LAD, another is RCA, and circumflex was occluded, so maybe acute phase. So and in emergency, so we performed the primary PCI in the circumflex. Mm. And however, so the patients could not recover from the cardiogenic shock. So maybe 3 days later, I performed the uh, CTO PCI, so LAD and RCA. Firstly, so I treated the LAD CTO with a retrograde approach technique from the RV branch. Mm. And immediately after that, so I so to perform the uh, PCI for the RCA CTO. So mm, and from with the retrograde approach technique through the uh, septal collateral channels. Uh, that collateral channels just was opened it. Mm. So the patient got recover so very quickly. Mm. Maybe this is my best case.
Wonderful. Wonderful. Again, sounds very complex and obviously the combination of acute and chronic. Um, how do you deal when you have a complication? Is that something very stressful? You get depressed?
It's very so stressful. So uh, firstly, so I um, explains my so worst case. Is it okay? Mm. So I have so two worst cases. One is RCA-CTO with low EF and obesity during the retrograde procedure, so thrombus formation in donor artery occurred. So because of not enough of heparin, the patient went to ventricular fibrillation and required VA ECMO system. So finally, the patient recovered, but he had several infarction. And another case is LAG-CTO in foreign countries. The patient had low EF and heart failure without enough treatment. So I tried the antegrade approach with a large amount of contrast, and it was failed. So therefore, I wanted to stop the procedure. However, so the local doctor hoped to continue it with a retrograde approach technique. During the retrograde approach, the donor artery occurs ischemic event, and the patient went to ventricular fibrillation. Finally, the patient could not recover. And I lost the patient. Only this patient.
Yeah, they don't.
Yes, yes. So
Yeah, these are
of course,
tough cases.
so I always make the best effort to prevent complications. Especially, so I check the patient's age and the cardiac function, such as LVF, congestion, or not, before PCI. So I mentioned previously I lost a patient in the CTO PCI procedure. I had been depressed deeply, very, very deeply, and considered throwing up the CTO PCI operator. And I asked my mentor's advice. My mentor is Dr. Masahiko Ochiai and Dr. Masahisa Yamane. Of course, you know, you know well
Of
them.
course.
Yeah, yeah, yes. They are my mentors. And after so long thinking so carefully, I decided the city of PCI. Of course, my mentors um, gave me as a very good advice. Mm. So I made my rules, my rules. Uh, so that's to make sure the assess the risk of procedure uh, and decide and end point of the procedure before PCI. So as far as I know, so that there is no algorithm so which assess the risk of procedure. Of course, there are many research which point out the risk factors of the CTO-PCI. What do you think of the Dr. Manos?
Yeah, no, absolutely. And these are, as you know, these are tough cases, and as you said, they can have a lot of stress and depression, and make you um, want to quit sometimes and not do it again. But I agree with you that it's a matter of taking the time to reflect and understand, what happened, and try to learn from it, and then move on to the next case. Because I
Yes.
mean, end of the day, there's no procedure that doesn't have a complication rate, and as long as you do the best that you can and you learn from all the complications
Yes.
and the things that did not go well, I think that would help the next patients have a better outcome for the procedure. So I completely agree with you. It is stressful, but we are trying to make the most out of what happens during those cases.
Thank you very much. So,
Now, maybe we can uh, ask you, what do you plan? How do you teach the other people? I know you do cases in Japan. You do cases in other countries, in Asia, Europe, all around the world. How? What do you find um, exciting in a student? What excites you in a student?
So what type of student?
Yeah, so someone who wants to learn from you, what makes you more excited to teach them and
Uh,
help them improve and get better?
yes, yes. I think the most effective education is the live demonstration. Mm. So, of course, so there are many conference which present good case, bad case. However, so it's a very there is a summarized the case. However, so live demonstration shows sometimes good course in the CTO-PCI, sometimes bad course in the CTO-PCI, and sometimes mm, the procedure did not advance so many 10 or 20 minutes. So, uh, however, I think that time is very important for the student who runs the CTO PCI procedure, not only summarize the cases.
Perfect. And you're right. It's a lot of learning trying to watch people deal with problems and challenges and find solutions to these problems. Um, how how many cases do you think it takes for someone to become a good CTO operator?
Yes, maybe 300 cases.
Okay.
It's I participated in the Japanese City Expert Registry. The regulation of the operator of that registry is 300 cases.
Okay. Okay. So obviously a lot of cases, and you
Mm.
always keep on learning, but there's nothing to substitute for volume and doing enough cases. Now, um, about your personal life, how do you manage to do these difficult procedures and perform? Do you exercise? Do you read some books? How do you get yourself in good shape to be able to do these difficult procedures?
Yes. Every weekend, I go to the Japanese sports gym for the physical training. So maybe once or twice a week. Mm.
Okay.
Okay,
Okay.
and
Perfect.
so I and maybe now I'm in the hospital. So maybe of course mm, I am in the hospital a very long time. However, after I back to the home. So I do not the work only
Okay.
hospitals. So I changed my mind and my I changed the mind so hospital and my homes. So and in the hospitals in my home, so I got to relax.
Okay. And how many hours do you sleep every day?
Uh, maybe before COVID-19, so maybe 7 to 8 hours. Mm.
Okay.
Maybe it's
Okay.
wrong. However, I got to the age maybe over the 50s, so it's a it's a shortening. Maybe now 6 hours.
Wow. So long hours at work and short time at home.
Yeah.
Um, but do you have any, or if you find any time, do you have any favorite book or any favorite movie
Uh,
that you enjoy?
so I read the Japanese novels the, on the bed, in the bed. Mm. And I like
Okay,
to see the movies, maybe so local so Japanese movies. And,
wonderful.
and I like the movie about the Japanese historical movie. And however, so my wife likes very Korean and Chinese movie. So every night she watches uh, some the Korean and Chinese movie. Mm.
Wonderful. Now, what are you most proud of from the things that you have accomplished, you have done so far? What are you most proud of?
Uh, so uh, before COVID-19, so every month I visit the foreign countries to perform the PCI or participate in the international conference. Mm. Mm. So the visiting the foreign countries is my proud. And
Wonderful.
so it is very interested in the experience the foreign cultures, and food and social society or person.
And then, do you feel, you as you say, you go to so many countries and you visit different countries. Do you feel that um, this makes everyone get into a same community? Is that highly rewarding? Interacting with other places, because it's also stressful, right? To be in a different cath lab and working with different patients, different equipment. Um, how are you able to work with the other teams to get the best results?
Uh, the sometimes mainly Asian countries, so they cannot speak English. Of course, I am good, not good at English. It is very difficult to communicate in the PCI procedure. However, I explained my plan and my the equipment I required and before PCI, and so we discussed my procedure. And for example, so I like to check the ACT every 30 minutes, and if the patient go down the cardiogenic shock, please I like to mm, use the noradrenaline and uh, other drugs. So before PCI, so I check them with the local staff.
Wonderful.
It's very important here.
Perfect. Yeah, exactly. And safety is important, especially when you're in a different cath lab.
Yeah.
What are the things that you're excited about in the future? Are new devices, new techniques? What are the things that you're excited about for CTO
Mm.
and complex intervention?
Yeah. So um, nowadays in Japan, so we try the tip detection ADR techniques. Mm. So do you know tip detection ADR techniques in Japan?
Yeah, so there's a nice tech intervention paper, right? So there was a nice paper
Yeah, yes.
describing the technique.
Yeah, yeah.
Yeah.
So especially uh, Telmo IBAS, which is approved only in Japan, as a very short chip, and with the 40 megahertz IBAS transducer, so we can easily advance it for the CTO region, and we can try it the IBUS guide wiring easily. So and we can check the direction of the guide wire chip. So it's a real-time IBUS guidance. So uh, the we perform the ADR with real-time guidance with IBUS. So it's uh, developed the very high successful rate in the in the ADR procedure. So now I am training the that procedure.
Wonderful. Wonderful. So again, thank you so much. That was great insights on how you learned. But if you have to give some advice to the new cardiologist, to the new interventional cardiologist who want to train in CTO or complex PCI, what would your advice be for
Uh,
them to become good?
when I trained the CTO PCI, so it's a it is that time we always try the new techniques and new devices. So every year, new devices are approved. So Corsair as another microcassette or a new iBus or a new stent. However, nowadays, new devices are very few. So and the data of the CTO PCI were reported. So it is very important um, to prevent the major complication in the CTO PCI. It is very important. So I think the very good advantage of the PCI. So we can repeat the CTO. We can repeat the PCI, and open bypass surgery is only once of the life. Of course,
Okay.
there is a cost problem. So it is advantage of the PCI. So we can perform the repeatedly. If we uh, notice the complications, so I recommend the stop the procedure.
Okay.
And
Okay.
uh, after thinking and deeply, carefully, so we makes try of the second chance to
Perfect. So do a staged procedure if things don't work.
mm,
And you're right that sometimes people it's best to stop and regroup and then bring the patient back, then continue and potentially have a significant complication.
yeah, yes. So I According to my rules, so I have to stop the procedure up to 3 hours. So
Okay.
even the guide wires did not pass. So I must make a plan to all my techniques and try every ability to success the procedure within 3 hours. I believe so that principle leads efficient and safe procedure and less radiation and less contrast dose and less complications.
Wonderful.
So I would like to inform to the younger operators. So it is to prevent the complication and make us a plan and before PCI. It,
Yeah, absolutely. And again, as you say, planning is important. The
yeah,
complications are critical. I think both of those are key aspects because if you have a lot of complications, you may actually have to stop doing the procedures because the administration and other colleagues will stop referring patients to you.
yes,
Well, again, I would like to thank you so much for taking the time to speak with me today. Again, it's been delightful learning from you what your course was. And again, thanks for everything you have done. And I look forward to keep on learning from you.
yeah. Thank you very much. It's a very pleasure to join with you today. Thank you very much.
Thank you for listening to the Sensei podcast.